Hello guys, this is Pran and today I'm going to talk about collapsing trachea in dogs. Collapsing trachea in dogs is a common and serious respiratory condition where the trachea weakens and flattens, making it difficult for the dog to breathe. The symptoms are chronic dry cough, often described as a goose horn cough that worsens with exercise, excitement, or pressure on the throat. Difficulty breathing, especially noticeable during activity or when pulling on a collar. Exercise intolerance. Dogs may tire easily and show signs of respiratory distress after mild exertion. Wheezing or gagging, particularly during excitement or eating or drinking. Cyanosis, in severe cases indicating a lack of oxygen. Fainting, if the dog cannot get enough oxygen, they may collapse or faint. The most commonly affected breeds include Pomeranians, Yorkshire Terriers, Toy Poodles, Chihuahua, Shih Tzus, and Maltese. For diagnosis, we can do clinical history and physical exam. Actually, vets will often diagnose based on the dog's breed, age, and symptoms. Radiographs to check for the collapse. Although sometimes the trachea can appear normal if it's not collapsing at the time of the X-ray. Fluoroscopy, a real-time X-ray that shows the trachea during breathing to observe the collapse dynamically. Endoscopy, a small camera is entered into the trachea to visually inspect its structure. And ultrasound, less commonly used, but it can show tracheal abnormalities in some cases. For the treatment, we have medical management and surgical treatments. Medications can be very helpful to manage symptoms and include cough suppression, for example, hydrocodone to reduce the chronic cough. Anti-inflammatories like corticosteroids to reduce inflammation around the trachea and bronchodilators to open the airways. Lifestyle change, for example, weight loss in overweight dogs, using a harness instead of a collar, and avoiding irritants like smoke or dust can be very helpful. Also, environmental changes. For example, keep the dog in a cool, well-ventilated area and reduce exposure to a stressful situation. In severe cases, surgery may be required to help keep the trachea open. Tracheal stent. These are placed inside the trachea to hold it open and prevent collapse. This is often considered in cases where medical management fails. External tracheal support rings. Less commonly used, these are placed around the trachea to provide external support. Prognosis. With proper management, dogs with mild collapsing trachea can live a normal life, though they may need lifelong medication and monitoring. But dogs with severe tracheal collapse may require more intensive treatment or surgery, and the condition can be life-threatening if left untreated. Even with surgery, complications like stent migration or obstruction can occur. And this is a picture of a Yorkshire Terrier dog and a collapsed trachea. This marks the end of my video. I hope you enjoyed it. So feel free to like and leave a comment for me. I will be motivated to produce more videos for you. Have a good day, guys.